Hello, welcome to the April edition from Traditional Osteopathic Medicine. I'm Richard Koss, osteopathic physician. The topic this month is stress. As we all know, we've been feeling significant amounts of stress in this past year with all of the pandemic and vaccine issues and political issues that are just stressing people out. Can't watch the news without death, destruction, and all types of issues that brings people's stress levels to the max. So how do we work with that from an osteopathic perspective? There are plenty of medications and drugs that can help temporize and mitigate some of the stressful factors, but the side effects are fairly devastating, and to be on them long term has some very difficult and deleterious effects. So the main thing, besides a good osteopathic treatment to help take the tension out of the tissues, to calm down the nervous system with there's restrictions and blockages in different aspects of the body framework, which we do with our treatments, one of the main exercises we always give patients are breathing exercises. So we're going to just think through a little bit of the effects of stress on and how it is expressed in the breath. We all know that when people have a panic attack and you're anxious to the max, you're holding your breath in, you're breathing shallow, your heart is pumping, and your what I call the brain hamsters, your thoughts are just spinning wildly. And this just keeps egging that stress nervous system, the adrenaline and the heart rate, and everything just goes off the charts. And you feel miserable. You can't sleep, you can't digest. And one of the bad things about stress is that your immune system is shut down. Because if you have a cut, a bruise, or minor infection, and you're going to be eaten by the local bear or saber-toothed tiger or dinosaur, you're not going to worry about the infection. You need to mobilize all your blood and forces to escape and run away, and we'll deal with the infection later. So all the main processes that keeps you healthy with sleep, digestion, and your immune system functioning all gets turned off in the moments of stress. And the problem with long-term stress, it really does have a huge effect on your physiology and illness and disease manifestations. So simple breathing that we give all our patients. One thing that you do, that you realize when you're stressed, your breath is held in high, your ribs are pulled up. The nerves in the back of the spine are the nerves that controls heart rate, respiratory rate, and blood flow. And so if you keep stimulating these nerves in the upper ribs, it keeps stimulating these already stressed out sympathetic nerves, so your heart rate and your respiratory rate is maintained at this panic stress mode. When you are relaxed, when you're in that vegetative state after a good meal, and you're digesting and you're resting, you're breathing in the lower ribs and your abdomen. So one of the first things we do is we have people realize that we are not going to breathe with our upper ribs and hold our breath in. I mean, a classic experience. If you want to stay stressed, take a deep breath in as full as you can and just let a little bit out and live here. And you're just going to stay panicked all the time. So we get your body and tissues to let go, let your ribs and shoulders drop down, and then you breathe with your lower ribs and abdomen, and this stimulates the parasympathetic, or your digestion, your rest and restore nervous system, and back down and amp down the nerve and nerve impulses into our sympathetic nervous system and the stress nervous system. So we have people very slowly breathe in through our nose. We breathe in and fill up our lower tummies like you're in your choir or your singing procedures. And so you breathe in as full as you can through the nose and out through the nose. And you breathe, and no stopping. You breathe in through the nose and no stopping, and you breathe out fully through the nose. And for the really stressed out people, you have to push the air out. Because if you hold your ribs and shoulders up for 8 weeks, this is your new normal. This is your maintenance and baseline position of breathing, keeping the shoulders up because you're constantly stressed. And so we get the ribs down, you breathe in and you let the air out and push the air out with your tummy muscles. It helps pull those ribs down, stimulate your parasympathetic rest and restore nervous system, and back down your sympathetic nervous system. And so you do this 3 and 4 and 5 times in a row, and that helps to calm down the nervous system. Now, with the brain hamsters, or the constant repetitive thinking that keeps you stressed out, what I call you do brain or mind surfing. So you just put your mind and just be aware of your breathing. Are we breathing up high? Are we breathing down low? So you breathe in and then let your awareness allow and see your breath exhale and push the air out. And so you focus on the breathing in and relaxing and breathing out, and breathing in, relaxing and breathing out. So if you focus on the breath and the lower restorative breathing in your tummy, that helps again put those brain hamsters and those stress thoughts and those angry, anxious, and panicky thoughts aside, so that then now we can start to calm down the stress levels and wake up our rest and restore parasympathetic nervous system levels. It's very important to do this before you go to bed, because it gets your thoughts out of your head into yourself, into your body, to rest and relax. We like to get people to start with 4 deep breaths 10 times a day, total of 40. Over time, we want you to get 5 and 6 and 10 in a row. We stop at 4 because after that we hyperventilate if you're keeping going in and out with a full breath. But over time, you can train your nervous system and physiology that you can keep the breathing repetitively in and out, 10 deep breaths and 15 deep breaths, nice and deep and slow, emphasizing exhalation. And I've had several patients that they use this as their sleep aid, that they usually say, well, I'm working on my breathing, my tummy breathing, my mind is is surfing my breath on the out breath. And a lot of them will say, I never make it to 20 because I'm asleep. And so the breathing is a nice mediator between the stress situations and unpacking that, unlocking the stressful levels, and getting you into a state of rest, relaxation, and restoration. So I hope this is helpful. I hope you get into your breathing practices. And this should hopefully help us through the current stressful states in the world around us that is in a panic mode and in a frenzy. So this is Richard Koss, osteopathic physician from our clinic here in Maple Valley, Washington, wishing you the best and hopefully that you breathe yourself into rest, relaxation, and restoration. Have a good day. Thank you.